Hello, my dear friends. I am Dr. B V Balachandra. I am a consultant pediatrician and allergy asthma specialist. Today, I am going to discuss on when you should actually ask for allergy testing. Now, I am sure that you will be coming across with different sector of patients with recurrent cold and cough, congestions or food allergy or some drug allergy or insect allergy. You will come across varieties of these patients. Should you ask for all patients for allergy test or only selected group or which allergy test? That's what I am going to emphasize on it today. Now imagine a patient comes with recurrent episodes of cold, running nose, sneezing or nose itching, and which is usually presents for few months. And especially if you get a family history, and especially if these patients have got symptoms in a particular point of time, say early morning hours, or when they go outside, or when they play with their pets, then you know that okay, something at that point of time is triggering them. So in a nasal allergy patients, it is the timing of the symptoms which is important. Giving the situation, exposure to a particular situation is important. Prolonged duration is important. Having a family history is important. Any other allergy symptoms if it is present, then you should definitely ask for allergy test. That will definitely help the patient and you in the management. However, if a patient has got occasional cold, in between the patient is all right. He doesn't have any seasonality, doesn't have any time duration, then most probably this patient is having recurrent viral episodes. He may not be benefited with allergy test. Similarly, with respect to cough or chest congestion, if it is at a particular timing or particular exposure or prolonged duration with family history, please consider allergy testing. With food allergy, you should be extra cautious. Why? Because many of the patients presume that they have a food allergy, or it may be a food intolerance, or it may be that it was a dislike of the food, or it may be that they had a food and during that particular time of whatever happened, they consider it as an allergy only. But again here, if any patient has got particular food allergy and when the patient eats that food multiple times, he has had few times the similar symptoms, that is repeatability. And if he doesn't eat that particular food, other times the patient is perfectly normal. Or sometimes you don't know whatever it is, suddenly patient has got a severe allergic reaction, anaphylaxis, then you should work it up this patient for food allergy. So whenever you are asking for allergy, based on which clinical condition, you may ask for that particular allergy test. For example, if it is a respiratory allergen, you will ask for house dust mites, storage mites, cockroaches, or grass pollen, tree pollen, weed pollen. If it is a food allergy, then only that specific food you will be asking it. Sometimes in an anaphylaxis, when you don't know, you may go for a broad panel. You have allergy tests like skin prick test, you have allergy test like specific IgE, you have an allergy test like a CRD. So, in fact, whatever you are comfortable with that, whatever you are trained with that, or whatever you have an experience with that, go with that particular test or take an help of a colleague who has got little more experience in this context. Bottom line, if it's an allergy problem, if you are suspecting an allergy, never leave it alone without testing. If it is not an allergic condition, though it may be repeated cold, if it is like a more viral trigger, wait for it, don't ask for allergic condition. Which test to do is based on your comfort, or your colleagues and your friends might help it out. So most of the times why we should do this test? To advise on a correct avoidance and some of the conditions like say allergic rhinitis, asthma, where there is an allergen immunotherapy which can give a great results for the patients, and the patient may do really very well in the long run. So with all this in the mind, I would close my session with saying that at every point of time you are like a detective identifying the allergen as a culprit and helping and saving your patient with a good outcome. Thank you.